Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque, and welcome to the March 20th, 2020 COVID-19 update for Dubuque County. The number of cases in Iowa is at 45, up from 44 yesterday. The governor just held a media conference about an additional case here in Iowa. Yesterday, Dubuque was notified of our first COVID-19 case. Are you worried about exposure? Rest assured that our communicable disease and public health staff are in part of a statewide tracing system and contact notification system, which we do for all communicable diseases. If you are an exposed person to a particular case, you will be notified by the VNA public health nursing staff who specifically work on contact tracing. What is an exposed case? Well, that depends. There are a lot of factors that go in to determine what kind of exposure you had and if it warrants follow-up from one of our public health nurses. The distance you were from that person, the amount of time you spend with that person, are you a direct caregiver of that person, do you live with that person, all kinds of different factors. And our exposure definition is based on direction from the Iowa Department of Public Health. So if you are an exposed person in need of follow-up, you will be contacted by a VNA public health nurse who specializes in communicable disease follow-up. You will be given instruction on how to isolate and watch for signs and symptoms and further direction if you should become ill. On a related topic, are you returning from spring break? You may be wondering how you can prevent the spread of COVID-19 when you get back from your trip or as you're coming back today. If you've been traveling in the past week or so and are coming home now, whether it was spring break or for business, understand that while there may not have been any confirmed cases of COVID-19 on the people you associated with or that you know of in the airport or wherever you were traveling, there are people who are asymptomatic. You may have been exposed. Since testing is still very limited, there's no way to be sure if you've been exposed to the virus for certain. So what do you need to do? Because we can't always know if an exposed case happened during travel, you might want to consider who will you be around when you return home. Could you potentially be putting someone at risk, like an elderly person or a person with an underlying health condition? You may want to take those things into consideration and self-isolate. We want to err on the side of caution and are urging Iowans arriving back home to self-isolate if you have any respiratory symptoms. If the symptoms are mild, you will not be tested for COVID-19 at this time. There's simply not enough tests. And why won't you be tested? Because really, at that point, regardless of whether your test is positive or not, we're going to tell you to do the same thing. Self-isolate for about 2 weeks. And you'll need to self-isolate until your fever is gone for 72 hours without the use of Tylenol or ibuprofen, you're symptom-free, no cough or shortness of breath or fever, and you have been symptom-free for at least 7 days since your first symptom appeared. These are a lot of instructions, and be assured these are all on our website at cityofdubuque.org/COVID-19 and the Iowa Department of Public Health website. These are sacrifices we must make if we want to limit the spread of COVID-19. We all have many loved ones, and those around us who could get sick, become hospitalized, or even die from the COVID-19 virus. Which brings me to my final point. Up to this point, our efforts have focused on ensuring that vulnerable populations who are most at risk to having a severe reaction to COVID-19 don't become infected. As I mentioned, the elderly, those with underlying health conditions. However, new data from the Center for Disease Control shows that 1 in 5 people aged 20 to 44 who test positive for COVID-19 are still requiring hospitalization. Now, this age group is not typically the ones that require hospitalization. for viral infections. So the severity of this virus should be taken seriously by all age groups. In Iowa, 10 cases are in the 18 to 40 age group. That's 22%. So in summary, to effectively combat this virus, we need each and every person to do their part. The generations of Americans before us made tremendous sacrifices for the freedoms and privileges we hold today. We each have a responsibility to honor those who came before us and set an example for those who will come after us in response to the COVID-19 pandemic. Let's all work together and fight this virus. Let's be remembered by our future generations for coming together during these dire circumstances and flattening the COVID-19 curve.